Hello and welcome to Human Being Hidden Depths, the podcast by Collaboration Global. And my name is Jill Tiney, the founder of Collaboration Global. And I am excited today to welcome somebody I've only just met relatively recently, but we had a fascinating conversation on day one. And it's an area that I am keen to explore. I have touched upon in the past, but I'd like to know more. So if I'm curious, I know that the people that listen to this podcast will be curious as well. So I would like to welcome today the wonderful Dr. Tess Lawrie. Thank you for coming, Tess.
Thanks very much, Jill. I'm looking forward to speaking with you.
Cool. Now, I know you're a very busy lady. Give us a rough idea of the kind of associations and committees and things that you do from a global health basis, a space from the health world.
Well, I used to be a consultant for the World Health Organization, preparing clinical practice guidelines. And also I have an honorary contract at the Royal United Hospital in Bath. And through there, I supported the Cochrane Group doing systematic reviews and evidence synthesis. But since COVID, my life changed quite dramatically because it was quite clear that the authorities were not following evidence-based strategies. And so myself and a number of colleagues around the world realized there was a need for the public to access, independent scientific evidence and opinion. So we set up the World Council for Health as an initiative in 2021. And it was really in the first instance to share common sense, science, and wisdom around COVID and how one could. We launched with an early at-home treatment guide because people at that stage were just being told to stay home, wait till you turn blue, and then call the ambulance and we'll come and check your oxygen. Yeah. It was really just stepping forward with the things that people could do at home, and we were that guide was downloaded millions of times, and we then also became aware that the evidence against the safety of the COVID-19 vaccines was mounting on the official pharmacovigilance databases, and the authorities weren't saying anything about it. So it was either gross incompetence or actually corruption, but the point was the public needed to be made aware. And so again, we came out with a statement cautioning against the COVID-19 jabs, highlighting the evidence on the pharmacovigilance databases. We prepared a report in June last year, highlighting the huge numbers of adverse reactions being reported internationally on the databases and the UK's MHRA database. And at the same time, we became aware of this push towards centralizing health policy in the World Health Organization. Now, most people in the UK would think that the World Health Organization has nothing to do with the health policies or the NHS or any health intervention that they receive here. But during COVID, everything changed. And for some reason or other, the WHO was dictating health policy around the world. So we saw the same things, the same bad strategies being rolled out across the world in every government. And the governments were all saying the same thing: safe and effective in respect to the COVID vaccines and the need for masking, which now is shown to be quite harmful. So, and lockdowns, of course, which destroyed businesses and economies. So why were governments listening to the WHO? Well, there was a centralization of power in the WHO, which now they are trying to make legally binding. So when we became aware around about May 2022, that there was this push, this development of the WHO pandemic treaty, as well as changes to the international health regulations that make the WHO the legally binding authority in the event of public health emergencies of international concern, we alerted the public to this as well. And then towards the end of last year, we sent a survey out. We now have many, many subscribers around the world. we said, you know, where do you want us to focus? And also we're funded by the public, by, you know, small donations that add up and help to support our work and our growing team. And they said, well, we want you to be the alternative to the World Health Organization. So we had to really put our thinking caps on, because we're a grassroots organization. We have more than 200 partners around the world, different countries. I think we number 54 countries now, representation among our partners. And the last thing that the world needs is another centralized structure saying, do this, do that. But what we have realized is that what is needed is a decentralized system. We need a decentralized approach to health policy making and guidance. And in actual fact, we need to decentralize health decision making right down to the individual. So we need everybody to take back responsibility for their health, the health of their families, and not to outsource it to politicians, supranational organizations like the World Health Organization, because these organizations and individuals do not have your best interests at heart. They are profit driven. Now, many people, if you do know about the World Health Organization, you probably think that it's some sort of philanthropic organization that helps poor people, you know, in other countries, but not this one. Right. Well, it's only responsible for 1/4 of its budget. So 3/4 of the WHO's budget is funded by voluntary contributions, and they specify how that money is spent. And this is why we find ourselves in a situation where we have a self-perpetuating pandemic industry, because the WHO gets to declare the pandemic real or actual, real or potential. The Director General does anyway. And then he gets to say what needs to be done. So who gets to develop the vaccines, whether they're safe or not, 5 days, 10 days, 100 days, or however long they say is okay for it to be, you know, to be determined, to be developed and determined safe. We know it takes at least 10 years to determine whether a vaccine is safe, or any drug for that matter. So, you know, so this is outrageous that we have this process whereby the supranational organization funded by certain states as well as private individuals and organizations can get to say that there's a pandemic and then say, well, you have to close your business, you have to take 5 injections a year, and you can't go out of your house for the next 6 months, and you can't travel unless you've got a vaccine passport and you've had your vaccines up to date. So there's a much bigger issue at stake, and this is why we are. You probably want to get a question in, but why?
That's fine. You've got to explain it all, so we got the full picture, and then we can go into the nitty-gritty. Carry on.
Yeah. So my work and our organization's work, as I say, we've been growing the team, is to decentralize our World Council for Health initiative so that every country has their own country council. We've established several councils in Asia already. We've established an Irish council. We have a couple of councils in Africa. And we are working as fast as we can to make sure that there are 194 country councils around the world, because those are the number of states that are represented in the WHO, and through which they're steamrolling these changes to the international health regulations without parliamentary approval. So these regulations do not need UK approval because it is already an existing document, the International Health Regulations from 2005. And what they're saying is, oh, we're just making a few changes, and so we don't need to ask the public. But this is bigger than Brexit, much bigger. You know, this is something that really gives the power of decision making around our health and our sovereignty, because we no longer would have the choice, to a supranational organization that's got competing interests, conflicts of interest, financial interests.
This is the problem, isn't it? Whenever you get money in the middle of something, then it's all going to get scattered, and things don't go well. I mean, for an outside person looking in a philanthropic way of looking at things, not necessarily philanthropic, that's the wrong word,
Humanitarian or?
Yes, from a humanitarian point of view, if you see the WHO in that space, you would think it's quite wise that there is a body that oversees a global problem to find a global solution. And to see countries operating individually around the global problem, and possibly not talking to each other and possibly ignoring advice from each other, then it makes sense. You know, you would want to have this all-encompassing organization, not necessarily with the legal clout, but with the advice of this is what we see as would work well because, and with reason and with discussion and with consent with the countries in order to move forward. To do things separately, it's a bit like local government, isn't it? Do you decentralize or do you centralize, or, you know, should we own the electric company or should we, whatever? All these problems are ongoing. Ultimately, it's people. We're dealing with people, aren't we? And while there are people out there that are looking to make a profit out of this, any disaster is going to have those people that see an opportunity, although albeit a bad opportunity, but it's still an opportunity that they can make money out of. I'm curious to understand how all of these things, I mean, when did you, was it literally from the pandemic that you went, there's something not quite right, or was there other worrying things going on beforehand for you?
Well, I think beforehand I had become increasingly aware that the World Health Organization wasn't really doing a very good job. Because disease and poverty, you know, the health of people is at an all-time low. And you know, if you look at Western countries, obesity, depression, diabetes, you know, heart disease, it's chronic diseases are just off the scale. So something is desperately wrong with the health of humanity, and it's, you know, so that on the one hand was just, you know, what on earth are we doing here? But then, as I say, when COVID came along, and I thought, how can they be declaring a pandemic? Because there isn't evidence to even declare a pandemic. There wasn't in March, let alone declare, you know, and then the lockdowns and the masking, the 6 meters, 6 feet apart, which is totally you know, there's just no science at all. And then to hear individuals like Dr. Tony Fauci in America, I think he's 80 or something, saying, I am the science, and then hearing the UN saying as well, you know, people need to know we are the science. There's something terribly, terribly wrong with the system that centralizes power like that. And then you realize that when you start to look at it, the pharmaceutical industry is so massive. They pay the biggest fines in history, you know, so they put as much money into their marketing and the media and all of that, and their propaganda as they do into their R&D, their drug development. So or they put a massive amount in anyway. So it's so they can afford to pay massive fines, and they can afford to be caught out for fraudulent activity. So the system is really, really broken. I would say it's totally dysfunctional. And if I could just address the point that you made earlier, isn't it a good thing that you have an organization that collates stuff? Yeah, so it's one thing saying we are the science and we will only look at this sort of information coming from the pharmaceutical companies to decide whether something's safe or not, or from if Dr. Fauci says something, or Bill Gates, who's not a doctor at all, says something. You know, Bill Gates said everyone must get vaccinated before people can, you know, before lockdowns can be ended, and that was sort of early in 2020, I think, or 2020 anyway. So that kind of dictatorship is very unhealthy. What we really need, because, you know, health is really individual. I'm sure you know that, you know, you can do a practice that doesn't agree with your daughter or your friend or your neighbor or whatever. So health is very individual. We're all unique individuals, and we need an individualized approach to health. While it's great to get some guidance, one needs to recognize that we need an individualized approach to health and staying healthy. So if I could just say, in terms of what ideal would be recognizing that countries have traditional medicines that we've never even heard of. Some countries have incredible natural apothecaries, like like Asia, South America, I mean, I'm talking continents now, but, you know, the Philippines, Malaysia, they, South America, Jamaica, you know, the Caribbean, Africa, they have natural remedies that actually work very well, but because you can't make a whole lot of money out of them and they can't be patented by the pharmaceutical companies, we don't hear about them. We only hear, so our hospitals and the NHS and that, they've been co-opted by big pharma. So the only, you know, if you go to the GP in your 10 minutes and you get to say, you know, I'll speak about my headache today and my sore toe tomorrow, you know, you'll get a pharmaceutical remedy. Yeah. They won't suggest, you know, some natural thing that you can just pick up at the, you know, at your health food shop or something. Yeah. So the way you would want in the next pandemic, because we know there's another pandemic coming, you know, you want to hear from all corners of the world, all different countries, and you want those country health leaders to get together, these country councils that we are establishing, to get together and say, this is working here, this is working here, why don't you try that? We can send you some of this. So we need that sort of thing, not you will only use injections and that is that, you know?
Yes, I 100% agree. And this is what I kind of, in my naivety, not knowing very much at all about the World Health Organization, is what I thought it was for. It was like you collect the information, you disseminate, you share, and you give guidance, not any, this is what we must do. I mean, at the time when the pandemic started, we were all in fear, weren't we? So you do what's, you know, fearful. You know, you come from a place of scarcity, we're all going to die, it's all terrible. So you do whatever you think you're being instructed to do. And there comes a time for any country, as in the Second World War, awful things are going to happen, but you kind of have to come together, which is kind of my consensus is collaboration. You come together, you support each other, and you get through what you need to get through. But you support each other through your knowledge, your experience, your wisdom, your intuition, all of those kind of things. And I get what you're saying is that, to me, what you're talking about with the separate councils, giving that advice and finding out what's working here, what's working there. I thought that's what the WHO was doing in the first place.
Yeah, unfortunately it's not, but that's what really needs to happen, you know. And those country councils, they need to be listening to their practitioners, because, you know, what happened with COVID was that these doctors were saying, excuse me, this is working, can I come and speak to you? Or we sent the evidence to the authorities, the MHRA, the FDA and the WHO, and everyone, all the doctors were ignored. The experience on the ground was totally ignored. And instead of the authorities saying, you know, they just said, we're pulling in with our, you know, with our big pharma injections and our very blunt approach, you know, and one size fits all, which was totally inappropriate, because some countries had very low incidence of COVID, you know. It was mainly, and now we see the highest number of deaths or the countries that experience are the Western countries, especially now. You know, now there's excess deaths of 20% or so in this country, week on week, because and nobody's talking about it, because the COVID policies were so disastrous. You know, we can go into that as well. Just the, you know, but there's so many. I'm sure everybody knows someone who's either died suddenly or suddenly developed cancer and died within 2 or 3 months, or you know, had a heart attack. Young people, or you know, there's and the newspapers are saying, oh, it's because you shook your duvet too hard, or because you ate that ham sandwich, or you know, it's not because of that. It's because an untested, inadequately tested intervention called the COVID vaccine was just rolled out to everybody without due diligence.
When was the WHO first started? Do you know?
It was in the 1940s. So it was the 1940s, and its main focus was sort of, well, Planned Parenthood was a big part of it, but its main focus early on was, you know, preventing infectious diseases and that sort of thing. But now, with these new documents, they're looking to, you know, they've named these things as public health emergencies of international concern. So this covers things like, the climate agenda. They might say, oh, well, human beings are bad for the climate, so they need to stay home for, or most of the day, or only go out of their 15-minute neighborhoods, once a year, or whatever it is. So it's changed from being just an advisory body for infectious diseases to there's some sort of authority on any kind of public health emergency of international concern that they can declare. And if I can just remind you that the head of the WHO is not an elected individual. He is just an appointed official who in this instance, Tedros Adhanom Ghebreyesus, he has connections to Bill Gates, to the Gates Vaccine Alliance, and so on. So it's not surprising that the WHO is advertising that it will have 500 new vaccines by 2030. So I think it's become, instead of a World Health Organization, it's become a World Vaccine Organization.
Also, it's an organization that was birthed at a time that was very different to what we have now. People hadn't started to suffer from obesity and diabetes and the cancers that we have today because of the way we live our lives, that has been basically funded through marketing to make us buy and consume these products, which has created the illness. I was talking to a lovely lady who you probably would want to have a chat with if you haven't already, Nicolette Rischer, over in Canada.
No, I haven't.
And she's basically teaching people around the world how to reverse disease, and it's done through what you consume, healthy eating, healthy mind, healthy body, all of those kind of things. And she has hundreds and hundreds of examples of how people have reversed diabetes, cancer, dementia, so many things. And this is why these things aren't widely known, or the assumption that I'm making, huge assumption, but think about it as you will. But what she's advocating doesn't cost anybody any money. So you are
so right. You are so right. Since we started this organization, and as I say, we're a grassroots organization, so we're not saying we're the experts and we'll tell you what to do. We're saying, tell us what's working. Yeah. And we are hearing from so many practitioners, and not necessarily medical doctors, but including medical doctors, about the metabolic causes of cancer and how it can be reversed. So we've been taught that cancer is this irreversible thing, it's a death sentence, and we're hearing more and more experiences from health practitioners about how you can reverse cancer. So if anything good has come out of COVID, and there's a lot good that has, it's this growing awareness that that cancer is a metabolic disease. It's not a death sentence, and there's a huge number of natural products that can be diligently taken to reverse the course of cancer, or by improving the immune system and that. So and not just cancer, so all sorts of diseases. So we really need, we're at this amazing time in history, really, where we can reevaluate and revolutionize our health, our concept of health and of health care. And I quite like the term health revolutionary, because people of the media, the pharmaceutical companies and the media have colluded to, I suppose it's really just bribery and corruption, to present this image of anyone who thinks vaccines might be harmful or don't work or they don't want to take them. They get called an anti-vaxxer, and that kind of has to silence them right away. Where in actual fact, I think at this point, vaccines have been around for so long, and we know that they're not working well, and we've got this huge amount of burgeoning disease all over the world. And so it's really time to relook and revolutionize things. So I use the term health revolutionary. I'm not an anti-vaxxer. I've done all the vaccine stuff, but now I'm looking at it again. And health revolutionary is just much more appropriate at this time. And label me if you will, but
I think what's interesting is that people out there, Joe Public, the likes of me, are going, I don't know the truth. I don't know the facts. I can't make my mind up because this person and there's this person and there's this crazy person over here and there's this really crazy person over here. And you kind of get swayed left and right all the time and you don't really know what to believe. And I think what I love about what you guys are doing is you're asking for this information to come through. And it's just like, can we have it verified? Can we have it, proven? It isn't necessarily science in a lab. Sometimes it's this natural, a tribe in the jungle or something.
It's views and experiences. Now, our ability to make sense of things and choices based on our experiences and by listening to people we trust is constantly being undermined. It's constantly under attack, that you have to believe what you see on the news. It's programming, they want you to believe, rather than to listen to your neighbor who said, my daughter had the jab and she hasn't been the same since. She's got some sort of chronic thing, or my husband died last week and, he hasn't been the same since he had his jab. So, there's this attempt to make us not trust our intuition and not trust the people that we would otherwise have trusted, those the elders that we used to listen to, and so yeah, we've had that all undermined. And
I think we've all had this reliance on the doctor, the so-called expert, and we have this, or have had, as I was growing up, it's like doctor knows best. And then we transferred that to science. So the science gives you the facts and this is what it is. And yet I saw a study a few years ago now where doctors in a hospital were, experienced doctors would use their intuition and their experience of like, well, we've done these tests, I think it's going to be this, we'll deal with that. If we don't deal with that immediately, there's going to be a problem. Where a junior doctor or somebody less experienced will go, well, we'll do some more tests, we'll do some more tests, we'll do some more tests. By the time they go, yes, this is what it was, exactly what you said. Oh, they're dead now, too late. And it's like, sometimes we have to follow our gut instinct, and sometimes we have to do what's right for us. And if that means changing your diet, if that means feeling safe and going and having a vaccine, if that's your thing,
yes,
you have to take responsibility for the choices that you make. And by condemning anybody else, all that's doing is making us separate from someone, and it's them and us.
Yes.
And the more we do the them and us, the less we actually can help and support each other. So I like the fact that what you're saying with these separate separate councils is just being able to get the best of the best. And then you've got a smorgasbord of like, right, for my family, this is what I'm going to take responsibility for, and this is what I'm going to choose to do. And more and more now, compared to back in 1940s, you didn't talk about going with your gut, did you? And there was a guy, not in the 40s, recently I met a chap called Dr. Fabio Mancini, who talks about whatever method to cure yourself you have faith in, it's the faith that you have that will cure you. It's not necessarily the doctor or the witch doctor or the voodoo person or the alternative medicines that are out there. It's the faith that you have in what you are pursuing, and that the power of our mind and our bodies is huge. But we don't always trust ourselves because we want to hand our responsibility over to somebody else. Well, the doctor said I should do this, so I'm going to do this. So we actually have to realize that we have choices, and the choices impact on the rest of the world that we make. If we're going to follow the pharmaceutical companies, we're going to get more of the same, and potentially it's going to get worse. If we're going to put our faith in scientists, they are discovering new things every single day. So the thing that they've discovered yesterday isn't going to be the same as it was next. So you can't necessarily put your faith in scientists because they're still discovering new things and don't understand that half the stuff that they have worked out to be, we think it's this, we think it's that. They've done a survey of 100 people. Whoop-de-doo, what does that prove?
But also, the system is just so corrupt, and what we've seen, from what's been published in the medical journals over the last couple of years, so much of it has been absolutely corrupted. And so we've had this approach, well, if it appears in the Lancet, it must be great, and if it appears but that's not the case anymore. The medical journals or scientific journals have basically been infiltrated by big pharma, and so there's this dependency between journals and the pharmaceutical industry. The same with the regulatory agencies. Our MHRA is 86% funded by pharmaceutical companies. So who are they going to are they going to enable our health, or are they going to enable profits from big pharma, who they are dependent on? So we really need, and what I hope, I know, yes, we can. We certainly are responsible for our own choices, and for many people it's just too much to think about, maybe my doctor doesn't know the best for me, maybe it's too much to consider that there's all this corruption. You want to believe that the authorities have your best interest at heart. So there's no judgment if that's the way you feel. But I would really, I'm really hoping that this COVID experience, and if people just look around and see how many people they know have actually become really ill in the last couple of years, I'm really hoping that will wake people up. And they don't have to do anything active. They just have to say no. Just say no. I'm going to wait and see now. Because at this stage, it's really safer to wait than follow the dictates of the instructions that are coming through our governments, from the World Health Organization, and from whoever's controlling that organization.
So if another pandemic is imminent, or in the not too distant future, what advice, apart from the don't get a vaccine, which it seems to be your call to action, how else do you think, for example, being isolated and being in lockdown, do you think that was the right thing to do at the time, or should we have been allowed?
No, I don't. But again, people do need to decide what they want to do. But I would certainly say, that people should continue to run their businesses. They shouldn't discriminate against people. They shouldn't they shouldn't wear masks. Masks are really bad for health. But at the end of the day, it's their choice. When I say I shouldn't, I'm just saying, ideally, whatever they say you should do, don't do. Just say no, because it's not going to be good for you.
What's your reasoning behind the masks? Because we've heard so much.
So it's been shown that for children, it affects their mental capacity, their concentration, it affects their health. We had a pediatrician, neurologist, neurosurgeon from the US speaking. She's been having these terrible infections in children's brains. And so it's really bad for you. It's like, why on earth would putting something over your nose work? Anyway, if it is a contagious virus, a virus is a very small particle. It will get through a mask anyway. So I don't know, it's like hitting a virus with a tennis racket, trying to catch a virus. So it's only bad. There's nothing good about a mask.
Wow. That's interesting, because common sense to me is that your nose is your filter for anything that's coming through. So if you put another filter on top of the filter, it should be good, better for you. Short term, the idea of children being in a mask all day long at school doesn't work for me. But yes, just short term, if you're on a packed train, is that the case?
If it makes you feel better, then wear it. But from a health and medical point of view, it does not help. And if you wear it for extended periods, it will harm, because it's moisture, it traps bugs. Yeah. It's, I don't know if you've seen some of those masks, they get really, really manky, and you think, goodness me, do you really think that's going to protect you from disease? But I know people do feel that if they feel more comfortable, it makes you feel less fearful and able to go out. There's no judgment. It's just, do what feels best for you, but know that it's not what they say it is. It's potentially harmful, especially if you wear it for long periods, and especially not for children. The other thing, from a psychological impact, it's so bad for society, because it removes, how do you reassure somebody that everything's okay? You smile at them, So it removes that ability to smile and reassure people that we're all going to be okay, we're all the same. It turns us all into the
connection. This is the separateness, isn't it? But not being able to smile or empathize just by your visual clues, it stops that opportunity to be able to connect in the briefest of moments as you go past somebody. So yeah, that would always be a concern for me along those lines. What I think the final message that you're coming through for me is no judgment. Do what you are responsible for your family, and find out as much information as you possibly can in order to make an informed choice.
Yes, I would like to say that we have great information. So I just, this is a policy brief called Rejecting Monopoly Power Over Global Public Health. And this is really essential for people just trying to understand the big picture of what I've been explaining about the centralization of power in the World Health Organization. So you can find this on our website at worldcouncilforhealth.org if you look for policies. And you can also download this, which is actually the World Health Organization amendments. This is the compilation of the amendments. And I just want to show you, in case you're wondering why I'm bothered. If you just open it on any page, you just see all of this new stuff that's just been added that gives the WHO power to tell our governments what to do, and then the governments have to tell us what to do and enforce it, without going through our parliament. So we do. It's not just our government is drawing this up with the WHO. So it's not as if our government is innocent. They are a party to this document that they're not showing us. And then we have another policy brief on the risks or the health, the effects of this digitalization on health and sovereignty. So I'm sure everybody may be becoming aware that the CBDCs, the 5G going up everywhere, there's increased surveillance. All of this is discussed in a policy brief that we have. So to really empower people with that knowledge, and just to say we are a trustworthy source. We have no conflicts of interest. We haven't got money coming in from big pharma or communications industries, the tech industries, or anything like that. We're funded by individuals, and we receive our information from the grassroots. So and we are doing our best to help and support at this time, and to bring to really make a better way forward for humanity, because it's clear that the systems we have are dysfunctional and not serving us anymore.
Would you suggest people write to their MP about these kind of things? Or
yes, in actual fact, all MPs in the UK have received this,
wow.
and they've received this as well. And we have a petition that's had over 100,000 votes to be debated in Parliament, and the petition closes at the end of October. But if you go onto the website, you can still find, if you go to the Great Freeset, the greatfreeset.com, the greatfreeset.org, the greatfreeset.org, you can find this information, as well as a new campaign that we're launching to help people realize that they don't need to be afraid. They can step away from fear and actually take this as an opportunity to reflect on life and set themselves free from the things that the dysfunctional approaches to health and living and their lifestyles and so on.
I think we have moved on from that beginning of the COVID space where we were in fear, and I think people are now informing themselves better and looking at other options. And again, I think if people can go to the website, World Council for Health, is that the one?
Yeah, worldcouncilforhealth.org. We also have a weekly live stream meeting, and we have a variety of topics. So if you sign up to our newsletter, we send out an email at the end of the week, and I think it's Monday morning, that gives you the link. Well, it's always in the newsroom, but it'll tell you what the topic is. And this past week, we talked about the childhood vaccination schedule. And this next week, we will be talking about human trafficking. This is Monday the 4th. We have various things coming up. We'll be discussing the WHO issue later on in September, as well as gain of function research, which is what's making these pathogens that are being shared. So so there's a lot. If you want to just stay posted and hear from experts who have no conflicts of interest, then please do join us on those Monday meetings in our newsroom.
Thank you. That's amazing. There's so much going on, so much going on. And I almost feel like we have a part 2 coming of this podcast, because I know you are very squished for time, so we have to let you go now, unfortunately. Thank you so much, Tess. Honestly, you've given us so much information and so much to think about. I think the bottom line is that there is hope, there is an alternative way, there is an opportunity for anybody to get involved if they wanted to. Is there anything that you would ask of the people that are listening on this podcast today? What would you need?
Well, so I would say, so the school's about to start. They're pushing these nasal vaccines. They are not tested. They are not safe. Do not use them. There's a letter being circulated. I shared it on my Twitter. My Twitter is Lawrie_doctor. And you can adapt that letter. It'll also be on Safer to Wait, which is an organization, a wonderful organization in the UK called Safer to Wait. You can download it from there, and make sure you make that choice. You don't let your child just get whatever they're giving in the schools. Yeah, you need to step up and protect your children. So, you need to engage and get active. It means taking time off work, then you need to do that. But overall, I just want to say that, there is a better way coming, and we're helping to facilitate it. You can help too. And this is our bumper sticker at the moment: be a warrior, not a warrior. And it's amazing how liberating it is when you step into your power and you step away from fear and say, I'm not going to worry anymore. I'm actually going to get active and empower myself. And help towards this better way, and the community and our communities. So yeah.
Thank you so much. It's been an absolute joy talking to you, and hopefully people will get in touch with you and see how they can help as well. And if nothing else, download those documents and read those documents and get onto the newsletter as well. So thank you very much for joining me today, Tess, and I wish you every success with what you're doing. It's been brilliant.
Jill, thank you so much.
Take care.